This is In Depth. With Indiana's mask mandate set to end next week, lines are being drawn as to whether Governor Eric Holcomb's decision to ease COVID-19 restrictions is coming too early. Within the hour, I was joined by Dr. Payal Patel Davladabadi to get her perspective. She's an associate professor of public health at the University of Evansville. Dr. Payal, good to see you tonight. We're going to start out with this question. What is your initial take on Evansville City leaders ending the mask mandate and issuing an advisory following the governor's lead?
Well, Brad, many states are doing this, and I think it really needs to be a measured approach. We do not need to end mitigation measures altogether. And so I do think it is too soon. Yes, Vanderbilt County is in the blue, but again, we still need to achieve that herd immunity before mitigation measures are ended. And even with an advisory, just a likelihood of people, wearing a mask, the majority are not likely to do so. And this can lead to an increase in cases. So it does need to be done in a measured approach, and I do think it's a little too soon.
Dr. Payal, Illinois and Kentucky still have mandates, of course. COVID, as you know, does not stop at state or county lines. Is that going to compromise our region, where Evansville is right in the dead center of?
There is a possibility, like you said, COVID travels borders, and people who are living in neighboring states that do not have those mask mandates, they travel to states that do, they most likely will not be following those mandates. So there is the likelihood of COVID spreading across borders, which is why it's essential to, again, keep those mitigation measures in place until we have, achieved somewhat of a herd immunity.
And after you are fully vaccinated, there is that, there's that feeling that things are indeed getting better. But why is mask wearing, in your opinion, important even after you are vaccinated?
Well, there are many reasons for this. First being that the two vaccines, the Pfizer and Moderna, the vaccines cover symptomatic infection. So we don't know much about asymptomatic infection. So those who are vaccinated can still be asymptomatic, and they can also be carriers of COVID. And so they can spread it to others that way. Secondly, there are those who have allergies to the shot and are not able to get a vaccine, and those who are immunocompromised were not included in the clinical trials. So we don't know how effective the vaccine is going to be on that susceptible population. And so for these reasons, it's really important to still wear a mask. There's still the possibility of spread. We have variants, and we don't know how effective these vaccines are going to be against those variants. So there, like I said, there's a lot of unknowns, a lot of ambiguity around the vaccine, around just, the true coverage of it with asymptomatic infection and the variants. So it's still important to wear those masks to protect yourself, but also to protect other people until a large portion of the population has been vaccinated.
And in Indiana, the statewide map is showing that there is moderate increase in spread, primarily in central Indiana and to the north of us. And we've heard about that so-called fourth surge. Is this something that concerns you for our area, especially with people coming down into the Evansville area from central Indiana, where in some areas there is an increase in spread?
There is a concern. There is a possibility of a fourth surge, especially when kind of ending those mitigation measures. But with a lot of people being vaccinated, that surge that we'll see may not be what we saw at the beginning of the pandemic, right? When we had those increase in hospitalizations and deaths. Yes, we'll see a surge, but we may not see as many hospitalizations as a result of that.
Well, on a positive note, Pfizer is reporting that clinical trials show its vaccine is 100% effective for children ages 12 to 15. Now, if that is verified by the CDC and other metrics, that could have a huge impact, positive impact on schools come fall. What do you say?
Absolutely, and these are initial findings, so they haven't been, verified by independent researchers. They haven't been peer-reviewed yet, but this is really exciting for that age group, just because they can have a good start to the school year, and not only that, they can minimize spread, but parents can feel more comfortable sending their kids to school, knowing that they've been vaccinated and that there's not going to be kind of a risk of spread. So it's great news, especially for beginning of the school year in August or September.
A question I've repeatedly have had, and you can perhaps help us on this. We hear about booster shots for other situations, like back in the day, the measles, polio, actually. And do you anticipate we're going to need to receive annual COVID booster shots in the future after 2021 finally gets behind us?
Yes, and the reason for this is the CEO of Pfizer has actually said an annual booster shot is probably very likely, and they're actually testing it right now. That booster shot would be the current vaccine in a one-dose form, or depending on the variants that are circulating, it could be a composition that incorporates those variants, similar to the flu, how the flu shot is made every year to incorporate the viruses that are circulating. So having an annual booster for COVID is very likely.
Thank you very much for your perspective. As always, Dr. Pyle, we appreciate you taking the time to talk to us. Thank you, and stay safe.
Thank you so much, Brad.
All right.